Good morning, friends of the media. Thank you for coming to the 11 a.m. Press conference on fighting against the epidemic. Apart from the Chief Executive, we have the Secretary for the Civil Service and the Secretary for Labour and Welfare here. They will also speak, and then the questions will be taken from the floor. Because of the epidemic, please keep your distance and please make sure you wear a mask. Chief Executive will say a few words now. Good morning, members of the media and the public. Together with the Secretary for the Civil Service and the Secretary for Labour, Welfare, we are here to give an account on the COVID-19 vaccination program that started since the 26th of February. Now, if you go to the World Health Organization's website on the COVID-19 vaccination, the first sentence says that vaccination could save your life. In fact, with the experience in the past year, we can see that for infected persons, whether they will have a serious condition or even pass away, there's a huge difference in terms of whether they've been vaccinated or not. And at the 4:30 press briefing each day, the Center for Health Protection and the Hospital Authority have been giving you analysis that among the death cases, in fact over 90% of them involved people who were not vaccinated. So that's why in the fifth wave of the epidemic, we need to boost the vaccination rate in the community. Of course, vaccines could reduce the cases of serious condition and fatalities. At the same time, vaccination is an important condition for schools to resume face-to-face learning and for the community to resume normal lives. That's why we are here to give you an account of what we've been doing. Now, we launched the COVID-19 vaccination program in 2020, and we have spared no effort in promoting this program on 5 fronts. One, the departments involved in implementing the vaccination program. You would know that from day one, it was the Civil Service Bureau under the leadership of the Secretary for the Civil Service that led the vaccination program. Because this is a major exercise, and we have rely only on the Department of Health, or they would be hard-pressed to cope with so much work. That's why they could not really focus on promoting the vaccination program. Now, I have asked Mr. Patrick Nip to take up this responsibility. It's not just because he's the Secretary for the Civil Service. He was also involved in information dissemination when he was in another post. And with the promotion of the vaccination program, we need someone with a strong network and someone who has the skills to disseminate information to the public. So that's why in the past year or so, I'm grateful to Patrick for taking up this responsibility. In fact, there are many websites on COVID-related matters, and I believe the COVID-19 vaccination program website is among the better ones. You are able to find much information there. The second point is that we have an adequate supply of vaccines with a choice. We have now 20 million doses of vaccines in stock, and then we have all the support measures in place. The third point is that we need various measures to facilitate the public to get vaccinated. So we have community vaccination centers, and then at hospitals, clinics, elderly health centers, district health centers, and then we also have outreach teams of over 1,000 doctors involved in the vaccination program. The fourth point is we want to ensure, we want to protect lives and health. We also want to offer incentives to the public to get vaccinated. So together with the business sector and various organizations, there was provision of incentives for people to get vaccinated. Well, there's a free flat, free car, and so on. So that's why we have this publicity campaign to encourage people to get vaccinated. And there's actually a song sung by a famous singer to encourage the public to get vaccinated. And the fifth point, or the final point, is that apart from offering incentives, we've also introduced a vaccine pass arrangement to encourage people to get vaccinated. Otherwise, people could not enter certain premises. At first, we started with the scheduled premises with this vaccine pass arrangement, and now we're extending that. But then that's not enough still, you could tell from this chart. Starting from February last year, we launched this vaccination program. We did rather well for some time, but then when the fourth wave of the epidemic eased for some 7 to 8 months, when there was almost zero infection in the community, people were not so keen to get vaccinated. And then there were also media reports that caused some people, in particular the elderly, to become reluctant about getting vaccinated. So that's why when we had the fifth wave of the epidemic, we saw comparatively low vaccination rate for the elderly compared to other cities such as the Singapore and so on. It's the case, the vaccination rate is particularly low among the elderly, and that's why we've seen so many death cases in the fifth wave of the epidemic. As I mentioned just now, 90% of the death cases involving the elderly had to do with individuals who either were not vaccinated or had just one dose of vaccine. Now, we said now our focus is on reducing infection, reducing serious cases and fatalities. So one aspect is, of course, to provide sufficient facilities, that is beds, treatment beds. And I said that we would try our very best to achieve what Professor Liang Wannian has suggested, that we will have beds ready, waiting for patients to take them up. But then in Hong Kong, what we have seen is that we have plenty of stock of vaccines, and we're waiting for people to take the vaccines. We have a comprehensive network for vaccination, and in the past year we have been appealing to the public to get vaccinated, and we have incentives to encourage them to do so. Now we have to do more, especially we need to protect the elderly and children. Now, there are still 300,000 people aged 70 or above who have not yet taken the first dose. As for children, the vaccination program started relatively late for them, and about 50% of children aged between 3 and 11 have taken the first dose, so there are still about 260,000 children who have not yet been vaccinated. So that's why our vaccination program will now focus on the elderly and children. And in particular, if children are all vaccinated, then they could go back to school after the Easter break. Taking this opportunity, I would like to thank various parties who have helped us with the vaccination program. First, the experts on the panel who have given us advice on vaccines. The second is two pharmaceutical companies that provide vaccines to us. And the third, the outreach teams and the medical staff that help with vaccination. And fourth, home operators and school operators who encourage vaccination. And then fifthly, I must also thank civil servants who've been helping with the task. And finally, I must thank the public for actively getting vaccinated. Now, for those who have not been vaccinated, in particular family members of the elderly, please support our vaccination program for the elderly. Now, I'll invite Mr. Patrick Nip, the Secretary for the Civil Service, to tell you more about our vaccination program, what we're going to do next. Thank you.
Thank you, Chief Executive. Good morning, the public and media friends. Now, I would like to update you on the latest progress of the vaccination program and our key works in the near future. Besides social distancing, testing, isolation, quarantine, treatment, and so on, COVID-19 vaccination is critical to reduce severe and death cases. It is the key measures for us to walk out of the plight. According to the CHP's data, the death cases we have seen, unfortunately, in the fifth wave, among them, 90% of them were either not being jabbed at all or were not fully vaccinated. For those who have received 2 jabs, the death rate would be 50% lower, or 5 times lower. As last night, we have already administered more than 8.3 million doses. More than 13.8 million doses. 60% or 8.3 million doses were BioNTech, and 40% were Sinovac. For members of the public above the age of 12, 6.11 million people have received the first jab. 5.34 million people have received the 2 jabs. Or 19.8% of the public were vaccinated with the first jab. 79.2% of the eligible population have received 2 jabs. 2.15 million people have received 3 jabs, or 50% of the public. Now, for those who are eligible to get the third jab, 50% of the eligible population have received the third jab. For those above the age of 60, the percentage is lower. Now, for children aged between 3 to 11, well, we have just started vaccinating those about 5 years old on the 21st of January, and we lower the eligible age for Sinovac to 3 years old on the 15th of February. So far, 260,000 children have been given the first jab, accounting for more than 50% of the group of those between 3 and 11. Now, for those between 12 and 19, more than 420,000 jabs have been administered, accounting for 95%. Now, for the working population, the adults between 29 to 59, 95% have been jabbed. For the age group 40 to 49, the vaccination rate is 99.94%. For the elderly group, those who have received the first jab between the age 60 to 69, that is 89%. For those between 70 to 79, 79%. For those above 80 years old, the vaccination rate is 54%. Although 90% of the public has been administered with the first jab, for the second jab, we have yet to reach 90%, so we have to speed up the vaccination progress. Here, I would like to thank the public's cooperation, as well as the medical staff from the public and private sector, as well as the supporting staff. Besides the civil service, since May last year, tourism practitioners have joined the force in terms and provided administrative assistance, and also businesses lent their premises and venues for us for free to serve as vaccination centers. And a lot of carers and outreaching teams take the risk and vaccinate elderly people in care homes. We thank them a lot. So we are racing against the time. We have been judging the epidemic situation and adjusting the vaccination program. Depending on the developments of the epidemic and the needs, these are our key focus. We will increase the number of doses administered. Since early January this year, we have 10 community vaccination centers. Since January, we saw a rapid increase in demand for vaccination among the public. We have added 17 vaccination centers to make the number 27. 20 are for BioNTech, and the remaining are for Sinovac. There are 3 designated vaccination centers for children and 3 for elderly people. We have increased the number of mobile vaccination stations from 2 to 4, roaming public estates and schools to provide the vaccination services to elderly and children. Now, with more vaccination stations, We have more than 1,000 private doctors helping us to administer jabs. The capacity has increased from 34,000 doses per day in January to more than 100,000 doses per day at present. Now, we can see that we have enough booking quotas on our website. In the past few days, the figure was around 70,000 or 80,000. We still have capacity. And also, we will focus on vaccinating the old and the young. Now, outreach teams for care homes, because we are speeding up outreach vaccination work for care homes, and we are focusing on that. That's why we have a clear goal. That is before the 18th of March, we will make sure that outreach teams are arranged for more than 1,000 care homes in Hong Kong to provide at least the first jab to all the residents to achieve a full coverage. And for eligible residents to receive the second and the third jab, we will also arrange outreach teams to help them. In the past week, we have recruited additional health care workers who are willing to join the outreach teams. And also, the number of outreaching medical institutions have increased from 5 to 16. It includes teams formed by the medical sector, including people working in the HA and the Department of Health. Now, some 720 medical staff members, many of them from the private sectors, have joined our team. As of yesterday, more than 1,090 among the 1,096 care homes for elderly people and care homes for the disabled, more than 970 care homes have received service from outreaching teams. Some 40,000 jabs have been administered, and some residents have received jabs at the vaccination centers. The vaccination rate is 52%. In the coming week, we will administer jabs for the eligible residents in some 130 care homes. The Department of Health has revised the criteria for receiving a Sinovac. That is to shorten the time intervals between jabs from 28 days to 21 days. And for residents who are infected, if they were not jabbed, after recovery, 4 weeks later, they can get the first jab and then the second jab after 3 months. If they have received the first jab and then get infected, and 3 months after recovery, they will be eligible for the first jab. The goal is to safeguard the health and life of residents in care homes. For children, they are also a target group. We will continue to strengthen our connections with schools to facilitate the vaccination for children. Now, for the first dose, the vaccination rate has exceeded 50%, which exceeded our earlier goal of mid-March. We hope that within this month, we can boost the vaccination rate for this group to over 90%. We rely on the cooperation of schools, teachers, and parents. Now, for community outreach vaccination, we have boosted up the vaccination capacity for elderly people and children. Also, we are arranging outreach vaccination at homes for those that have mobility issues. The number of people in this group is smaller, but still we will strive to achieve our goal. When we have the details, we will make an announcement as soon as possible. And the second dose and the third dose are equally important. For the second dose, we are approaching 80%. We will further raise it to 90%. With the second phase of the vaccine vaccine pass implemented, that is, you have to get 2 doses to comply with the vaccine pass. That will be implemented on the 30th of April. We believe that more people will get vaccinated to protect yourselves. The third dose is also important. If you are eligible, you should get jabbed as soon as possible. For those people above the age of 60, after 3 months after the second dose, they will be eligible. Now, the vaccination program has begun 1 year ago. Now, today is the 379th day. Now, in this period, we have raised the vaccination rates to over 90%, and we are improving the vaccination rates for elderly people. In the second half of last year, when the epidemic situation was stable, we have made use of every means to boost the vaccination rate. However, the public was not very eager to get jabbed. Now we can see that over 10 billion doses were administered globally. Evidence shows that vaccination is key to reduce severe and death cases. Vaccination is the most important tool for us to come out of the epidemic. In order to protect yourselves, your family members, and our public health care system, we should all get a third jab as soon as possible. Thank you.
Thank you. Now the floor is open to questions. If you wish to ask questions, please raise your hand, and when you're called upon to ask question, please identify your organization and then use a microphone to ask your questions. The lady in white on the front row. Good morning, Chief Executive and the two secretaries. I'm from the Phoenix TV. Now, on the 18th of March, by the 18th of March, you will complete the administration of the first dose of vaccines to all elderly home residents. So would you have a similar goal for elderly in the community? Would you consider vaccinating all eligible elderly persons in Hong Kong as the next step? Now, the people question that Omicron is highly transmissible, and elderly have always been a high-risk group, and there have been outbreaks in residential care homes for some time, and only now you are rushing to vaccinate the elderly and to come up with some strategy policies to manage homes. It seems that you've acted rather slowly. So how come you didn't make prevention ahead? Or didn't make a prevention measures ahead? Is it because you overlooked this gravity of the situation? And about closed-loop arranged management of care homes is voluntary. If that's the case, how effective is it to prevent infection? Would you consider making the closed-loop management compulsory? Now, you say you are going to include more civil servants to help in the fight against the epidemic. Would you be providing more support to care homes? Thank you. You asked two specific questions. I will first invite Mr. Nip to answer your question about what to do next after we've vaccinated elderly home residents. For the fifth wave of the epidemic, residential care homes for the elderly and the disabled have been seriously affected. There is a high percentage of infected home residents and workers. There's also a high fatality rate. So how are we going to protect these homes? And what we've done in the past, in this past period, I will ask Mr. Nip to explain to you. First, about vaccination in residential care homes. Since we launched the vaccination program last year, we've been promoting vaccination in homes. In fact, we have done 2 rounds of outreach vaccination programs in care homes. But then for residents, their family members, for the outreach teams there have been some issues. And that's why the vaccination rate did not go up so much. And then we implemented other policies. If residents are able to make their own decision, and as long as they give agreement, then doctors could vaccinate them. or where residents are unable to make their own decision, if their family members, the social welfare department will ask them for consent, and if they don't agree, then they must give a written give this agreement in written form, and then doctors will assess the condition of these residents, and they will be vaccinated if the doctors deem them to be suitable for vaccination. And then we've also been enhancing coordination and our efforts so that all 1,000 plus care homes will be visited by outreach teams by the 18th of March. And it's not that after we've completed the administration of the first dose by the 18th of March, that's the end of our work. No, we will continue to administer the second and the third doses as appropriate. Now, for community vaccination centers, they have same-day discs and quotas, and then we have a mobile vaccination stations, and then we also have vaccination days to facilitate the elderly to be vaccinated. I'm referring to elderly in the community. And then there are also medical staff on site to give consultation and advice, so the elderly could get vaccinated at once. Now, for at the beginning of last year, for those aged 70 above, the vaccination rate was 36.5%, and now it's 68.9%. In fact, I'm talking about just 2 months since the start of the fifth wave on the 30th of December. So in a few months, we see there's a substantial boost in the vaccination rate. Vaccination program is a program where there must be consent given by the individuals concerned. So that's why we've been using various measures to facilitate vaccination. Also, we ask experts to give out information on vaccination in our effort to promote the vaccination program. On mobilizing civil servants, oh yes, we have to work on fighting the epidemic on various fronts. For homes, the Department of Health and the Social Welfare Department were involved in promoting vaccination. So actually on different fronts, for civil servants who work in different departments, whether these departments are directly related to the fight against the epidemic, actually most civil servants are involved in one way or another. If I may add a point about vaccination, on protecting home residents, the most important tool is, of course, vaccination. And as you know, we've been promoting this program for a year now. At the end of last year, we were still trying hard to boost the vaccination rate. 20% of family members were refused to let the elderly or to let the elderly residents to receive assessment. And then for another 30% of family members, they refuse to let the elderly family members get vaccinated even if they are assessed to be suitable to do so. The situation is improved now, but still there are 10% of family members who are opposed to vaccinating their elderly residents. So I would like to take this opportunity to say this. In fact, if elderly residents get vaccinated in a home environment, they're protecting others too, and not just themselves. Imagine if someone is not vaccinated and he or she is infected, then there's a high chance of that person infecting others. So vaccination is for one's own good and also the good of others, especially other residents living in the same home environment. So for 10% of family members who are against vaccinating the elderly, I hope they will change their mind. I hope they will give consent to the elderly family members to get vaccinated, because this will protect the elderly persons, other home residents, as well as the workers. Another important area is about manpower. Well, I know you've heard all about it. Probably we've been talking about it for many years, that there is a serious shortage of manpower at residential care homes. That's why a few years ago, for subvented homes, we have increased the provision, the funding provision, so hopefully homes could attract more people to join them. But then there is still a shortage of about 20% at the beginning of this year. So as we consider how we could retain existing staff and encouraging them to stay on, and also we have to consider how we could recognize their hard work during this time. That's why under the anti-epidemic fund, we're giving them a $2,000 subsidy. And then also, if there are infections, if there's infection in a particular home, then each staff member will get an additional $500 of allowance daily. But then we know there are about 10 to 20% of employees who've been infected or who are close contacts under quarantine, so they could not go to work. And add to that the 20% shortage, that means we have about half of the workers not being able to work. So we need to provide manpower somehow. So it's about recruiting either temporary manpower from the mainland or in Hong Kong. So we need to hire an additional 1,000 employees to help us take up work at the community isolation facilities and the respite centers in the next 3 months. And then for we need to allow government organizations or other private organizations to hire staff from the mainland. We would like the support of the relevant parties so we could bring these people to Hong Kong as soon as possible to help out. The third issue we face is about venues. You know, we have a serious shortage of home premises. The space per capita, especially in private homes, is on the low side, and that's why we're going to put forward a bill to the Legislative Council to improve the area per capita for home residents. But then that's a long-term measure that cannot address our immediate problems. Now, you know, for homes, we see that the average space per capita is 10 to 16 square meters. But now we are seeing a situation that many workers are unable to go to work for the reasons I mentioned. And then, of course, we've been discussing the closed-loop management with the sector for some time. We've suggested to homes that if you could find a way so your employees don't need to go home, we will support you with policies. About 2 to 3 weeks ago, we started to explore the possibility that homes could build some temporary facilities. And you can imagine the quickest way is to do conversion on containers. So this week, there will be some 10 plus containers installed near homes. So if employees don't need to go home and could stay there. Of course, these temporary facilities could also be used for isolation purpose, so there is flexibility. It depends on the situation with each home. And then there are other organizations which operate other facilities, for example, guest houses. So these could be used to accommodate their employees for closed-loop management. And then at the beginning of this week, we have stepped up our effort to promote closed-loop management. One difficulty we faced initially was about finding places to accommodate these people. You know, the government has worked very hard on the whole to get help from the hotel sector, and we're glad that we have received help from them. And so now we are seeing more and more isolation facilities. And also with the support and the leadership of the central authorities, we are seeing an increase in isolation facilities. So starting from this week, we're able to use some of the hotels originally planned for isolation purpose to be used for accommodating care home staff. Of course, there would still be some constraints, but now we have hotels that could be used for implementing the closed-loop management for care homes, and it's only just started this week. With closed-loop management, of course, we hope all homes and all employees will support that arrangement. But then there are two challenges here. One, for some employees, they have to take care of their own family, so it's not possible for them to take part in a closed-loop arrangement. But then if we buy into be stringent and say, well, if you don't join the closed loop, then you are not allowed to come to work. Well, remember, we've already lost 50% of the manpower. And then some people if some people are forced to resign as a result of the closed loop arrangement, it will only mean that elderly residents won't get some adequate basic care, let alone health care. So that's why we are resorting to all means to help homes as far as possible, so they could put in place closed-loop arrangement as far as possible. Now, if we can't do it 100%, at least maybe in 80 or 90% of homes could do that, it would be good. It's all a matter of risk level. If more homes could implement closed-loop management, then we could minimize the risk of outbreaks and infection. That's the goal we're working towards. And starting from the day before yesterday, there are some homes taking up hotel accommodation to implement closed-loop arrangement, and that's what we've been working on now. Thank you.
繼續每位記者兩條問題。
Let's continue. 2 questions for each reporter. What about the targeted timetable for elderly people receiving the first jab at care homes? Now we are promoting vaccination for elderly people over the territory through multiple means. Elderly people in the community have to possess the will to get vaccinated. In terms of capacity and stock of vaccines, we have enough stock. The lady in red. Good morning, I'm from Manpower Daily. Would you please speak up? I'm from Manpower Daily. How many people in care homes who are eligible to be vaccinated have not been vaccinated? And we only have 1 week left according to your timetable. So do you have confidence? And more than 1,000 residents have passed away. They were care home residents. Is it too late to set up the outreach teams for care homes? And according to the medical workers union, the Department of Health provided them with a list prepared by the Social Welfare Department. However, some care homes told them that they have already received visits by outreach teams, and some elderly care homes have even closed. So why is there the misunderstanding? According to Professor Liang Manian and another mainland experts, we should adopt a precision approach. So even with a higher vaccination rate, it is not in line or aligned with the social distancing measures. Is it not possible for us to achieve a herd immunity? Now I will take the first question, and then Mr. Patrick Neep will talk about the promotion of vaccination at care homes. Social distancing measures are still necessary in the fight against the epidemic. If you look at the WHO's thematic website about the COVID, it says a reliable and a safe vaccine would be a game changer to stem the raging epidemic. Before we have reached that stage, however, we have to exhaust all other means, for example, personal hygiene, mask wearing, and social distancing. So it is not as simple as that. It is not that if we have reached a certain level of vaccination, we can do away with all the social distancing measures. The most important effect of vaccination is to reduce the severe and death cases. It may not be so that vaccination would make us so safe that we can do away with the social distancing measures. In the second half of year 2021, our vaccination rate was not too high. However, we have relaxed most of our social distancing measures. So in short, we need a combined approach. We haven't reached that stage yet. We are still closely monitoring the daily confirmed figures, comprising a PCR and RAT test results, to gauge whether we are plateauing or whether we haven't reached the peak yet, or have we entered a downward phase. It is still too early to say. On the 22nd of February, I have announced that it appears that the social distancing measures as well as a suspension of schools would be extended to the 20th of April. However, if we have a very favorable condition, that we will consider relaxing the social distancing measures. About vaccination for care homes residents, now for the 1,096 care homes for elderly people and people with disabilities, according to the latest figure, 40,000 residents have been administered with the first jab, accounting for 52%. Now the target is to have outreach teams visiting all care homes by the 18th of March. Now, after all the effort, some 130 care homes remain to be visited by by outreach teams. Now, among the 78,000 residents, concerning the number of residents eligible to receive the first jab, we will have a better idea after we have completed this stage. Recently, we have seen outbreaks in care homes. Some elderly people are infected and they are not eligible to get jabbed at present. So the 18th of March is a phase, and the ultimate goal is to have outreach teams. Outreach teams have to visit all care homes by 18th of March, but there are a lot of follow-up works to do. For residents eligible for the second and the third jabs, we will arrange outreach teams to administer doses to them. Work is ongoing, involving mainly the social welfare departments and the Department of Health. They are responsible for liaising with care homes as well as the outreach teams. Recently, we have seen how important liaison and coordination is. Like you said, some lists are not updated. Some care homes may say that they are having an outbreak and they don't want outreach teams to visit them now. So we have assigned an officer from the SWD to work with every outreach team to act as liaison officer. So when there are any inquiries from the care homes, the SWD staff member will directly liaise with the care homes. This arrangement, we are seeing results from this arrangement. A clearer message has been sent to care homes, and care homes fully understand the criteria for vaccination. So we will enhance and improve our measures and revise our arrangements if necessary.
Good morning, Mrs. Lam. A new HKU study by Ben Cowling and Gabriel Leung has shown that the ban on dinner dining services had no noticeable impact on reducing transmission during the third and fourth wave of COVID. Would your government consider to lift the dine-in ban in light of the new findings? Second, if an arriving passenger tests positive at the airport and then negative on rapid tests on day 6 and 7, they're free to go. But if they test negative all along, they must do the 14 days quarantine. What's the logic, and will that be rationalized? Why not shorten the inbound quarantine to 7 days, freeing up hotel space for isolation facilities? And finally, the government has blamed people with ulterior motives for the recent panic buying. Yet there were U-turns and over lockdown and officials leaking details to the press almost daily, perhaps trying to gauge reactions, but causing confusion and chaos. Government sources say this and that. With lives at stake, should the government get a grip of their ministers and speak on record with one clear, unified voice? You said communication will improve. Can that be part of it?
Which organization are you from?
Hong Kong Free Press.
Thank you.
Of the three questions, let me answer them one by one. First is I was also a bit surprised by this study quoted in some of the newspapers done by the Hong Kong U team. As you know, throughout the 2 years of fighting the epidemic, we have been working very closely with the universities. We have been funding a lot of research and studies and vaccinations and so on carried out by the university. So I got this clarification from Professor Gabriel Leung this morning that the report about the dine-in ban for evening had no effect whatsoever on suppressing the epidemic and the spread of the virus has been taken out of context. Because I have not read the full report, but I got this clarification from Gabriel, and he categorically told my colleague that we could quote him, that that statement was taken out of context. Actually, if you thought through, it's not quite logical. If we don't allow people to come in a restaurant, that must have a better effect than allowing people to come in, take off their mask, and then have the meal together. So that's point number one. Now, point number two, actually, I do appreciate the sort of frustrations of some of the arrivals from overseas, that while we are adjusting our own quarantine and isolation policies, and also introduce a discharge criteria by the Center of Health Protection that will enable people under quarantine or under isolation to be discharged after 2 repeated tests on day 6 and day 7. Are still adhering to the same quarantine arrangement for inbound travelers. I did explain it yesterday to another similar question. This is because of the risk that we must ensure that we will not impose further on the hospitals. As I said, I can understand the frustrations, but at this moment, Hong Kong is facing an unprecedented epidemic. So at this point in time, my first priority is to ensure that we could protect people in Hong Kong and also protect the public hospital system. So to make any relaxation of for arrivals, which will run any risk in those respects, is not something the Chief Executive would like to see. But I did say that after this wave subsides, we will take an overall look at the border controls, particularly for inbound arrivals, particularly for Hong Kong people who are now not allowed to come back because of the place-specific flight suspensions. We will try to map out a pathway for resuming this travel for people who want to come to Hong Kong. Now, I could not readily accept your accusations on two fronts. One is the government was making U-turns on its anti-epidemic policies and practices. Second is government officials deliberately were leaking information to the media or to the public in order to gauge reactions. Now, on the first accusation, my response is like this. This is an unprecedented situation. In terms of responding to an epidemic of this magnitude, it has outgrown the normal capacity of the Hong Kong SAR government, or actually outgrown the capacity of Hong Kong. Where do we get all this manpower? Where do we get all these isolation facilities? Where do we get all these hospital beds? So in a situation like this, any adjustment in policies or in practices are to enable Hong Kong could cope with the situation as best as we could enable us to protect the public hospital system, but at the same time also to save lives. For example, we are now turning the Queen Elizabeth Hospital in a designated hospital to look after COVID-19 patients. If you asked me 3 months ago, that was inconceivable. Why should QEH become a dedicated hospital? So this could not be regarded as a U-turn. This is a timely adjustment in the policies in order to achieve the objective of protecting the safety and the health of the people of Hong Kong. I hope you understand that. Now, unless you can produce evidence that my senior colleagues or ministers were doing the deliberate leaking that you refer to, I could not accept this accusation. But never mind, from now on, 2 days ago, I started this daily press conference. So I am the authoritative source of anything that the Hong Kong SAR government is doing in this fight against the epidemic. I would suggest that if you have any queries, you come to these daily conferences, you ask me, I give you a direct answer. But don't accuse my ministers. My ministers are all working very hard in fighting the epidemic. But I do see some leakages, but I could not trace the source of those leakages. I could tell you that I am as frustrated as some of you when there were government information being leaked out, which should not be the case. And we will be as open and as transparent with the people of Hong Kong in order to instill the needed confidence in taking Hong Kong out of this major public health crisis. Thank you.
好，第四位記者，後排最邊個位女記者？係呢位。
The lady at the back. I'm from Hong Kong Economic Journal. 3 questions, 2 questions please, because we have limited time. The government has been saying all along that there will be compulsory universal testing this month, and that's why there was panic buying of daily necessities because of possible lockdown. But now you're saying that this is not your priority task. No, if you say that, would you lose the confidence of the public and people think that you're crying wolf? Second question, now you personally made a complaint with the DAB. Because they put out a statement say that the government only sent principal officials to receive the mainland express, and later on they sent a letter to make an apology. So do you think that would affect your working relationship with the legislature and how you could improve communication with political parties in future? First, compulsory universal testing is means. I said on the 22nd of February that we would use all possible means to fight the epidemic in a community, and some electrical members have suggested a compulsory universal testing. And we said at the time, where we have certain capacity, we have to put it to the best use possible. Now, Professor Liang Wanlian, the mainland expert, said that we have to use resources in the most effective way. If we are to launch a compulsory universal testing, it involves huge manpower resources. And then if we have also have compulsory testing notices and restriction testing declarations arrangement, perhaps we could focus on that too. But then at the same time now we're starting to receive continuous support from the mainland, and that's why we could consider this as an effective tool. But we have to do it at the right time. That's what the mainland experts have suggested too. So what we're doing now is to try to do it at the right time. We are working out all the details and making all the preparations before we proceed with compulsory universal testing. This is a major exercise, as you know. You might recall that in September 2020, it took us 2 weeks to test 1.7 million people. At the time, we had to mobilize massive resources to achieve that. So we are not the one causing panic among the public, but rather there's been speculation online. And people say something's really weird and odd, and that's caused such behavior from the public. But of course, I agree we have the duty to make clarifications at the first instance. In fact, when the panic buying started, we did make clarifications on a number of occasions. So I hope you could see that. Now, in our fight against the epidemic, we need to involve the whole community. We need the community to have confidence and trust in the government. At the first press conference on the fight against the epidemic in January 2020, I said there are 3 principles we adhere to. The first one is openness and transparency. Because in 2020, at the time, we were still combating the black cat violence. There was huge body of false information circulated online. There were many incidents that tried to undermine the governance of the government. And so if there was not enough public trust, that would directly impact our effort to fight the epidemic. And that's why in the past 2 years, we've been trying to be open and transparent, so people will have more confidence in our work in fighting the epidemic, and indeed in all our other work. So, and we want there to be report of facts and information, so people won't engage in certain behavior that's really unnecessary. Well, if I could tell you, tomorrow the press conference will be about provision supplies. The Secretary for Transport and Housing, the Secretary for Commerce and Economic Development will join me at a press conference. We'll explain to you how we try to ensure the adequate supply of medical supplies as well as non-medical supplies such as fresh food, vegetables, and so on. We want to make sure there is a steady supply of various necessities, so people don't need to go for panic buying. Now, let me clarify here, I did not lodge a personal complaint with the DAB. Over this period, I did not come into contact with any members of the DAB, so I did not make a complaint to the DAB. Perhaps the DAB, after checking the information, found that they overlooked press release I issued that on the 4th of March, I had detailed discussion with Professor Liang, and I heard their views. That's why they eventually issued a press release to clarify the matter and even offer an apology. The chairman, Ms. Starry Lee of DAB, passed on the press release to me, and my response was not to worry. So my response to Ms. Starry Lee was not to worry. But that shows that perhaps that means not many read our press release. That's what I told her. And I even said to her that if in future DAB members have any questions about our work, they could always make inquiries with the Chief Executive's office. So that's what the matter was about. It's really not about executive-legislature relationship. Now we have candid exchanges with all political parties, and the central authorities have demanded that everyone needs to join this fight against epidemic. Thank you. So that's the end of this press conference. We'll see you again tomorrow at 11 a.m. Thank you.